Alright guys, so this lecture is about patient scheduling and then processing those patients through that. And this is a two-part chapter, so there will be two lectures with this information. And this first chapter, what we're really going to focus on is just different types of appointment scheduling methods. We'll talk about defining, spelling, and pronouncing those vocabulary terms as always. We'll describe guidelines to establishing an appointment schedule and creating an appointment matrix. We'll discuss the advantages of computerized scheduling appointments. We will discuss the appointment book scheduling and explain how self-scheduling can reduce the number of calls to the healthcare office, and we'll discuss the legality of the appointment scheduling system. Today we'll also discuss the pros and cons of various types of appointment management systems, and we'll discuss telephone scheduling and identify critical information required for scheduling new patients. And then we'll discuss scheduling appointments for established patients, and then also how the medical assistant can handle scheduling appointments for different types of appointments. So today, to get started here, we're going to talk about establishing the appointment schedule. So this is like the first time you're in a brand new office and it's opening for the first time, welcoming patients into your office. There's a lot of things that you have to establish beforehand. So the patients need to feel that the doctor spent enough time with them. That's first and foremost. Your patients are your customers. They're the ones bringing that money into the office. They have to feel like they're spending their money at a worthwhile place. So effective scheduling allows providers to spend adequate time with their patients. Now there's a couple factors that will affect scheduling, and those are the patient's needs as well as the provider's habits and preferences. So the scheduling person needs to learn each provider's habits and preferences in order to schedule appointments so that the provider stays on schedule. So knowing everything, what the patient needs, how the doctor or physician handles everybody is really important to creating that schedule. And this is a really important chapter. I never mentioned it to you yet, but this is a huge chunk of your CMAA exam. So knowing this is super important. So those two factors we talked about, the patient's needs and the provider's habits and preferences. The first one is patient's needs. So determining office hours and appointment times requires consideration of the socioeconomic status of the area that you serve for your clinic. Okay, what I mean by socioeconomic is, what are the jobs like? What is the age range of people? Where is the majority of people spending their day? When are they free to come into the office? That type of thing. So here we go. Some more examples is your area rural or urban? How old are your patients? Is it a residential or more of an industrial area? What type of patients are you seeing? Is it evening and weekend appointments, or are there daytime appointments as well? So those are all things to consider. So the scheduler must allot time based on the patient's needs for each individual visit. Now, a quick follow-up is going to be scheduled for a lot less time than a minor surgical procedure. So you really have to know exactly how to allot time for those. So the balance between meeting the patient's needs and the provider's preferences and the available facilities is optimal for having that flow through the office and bringing in the most patients into the clinic. So individual patient needs could include the following things: the purpose of the visit, how old the patient is, the time needed with the provider, are they a parent or are they a student, can they travel after dark, are they unable to take time off of work, and then or are they a child with working parents who would only be able to see them at specific times. So those are all patient needs. Now providers' habits and preferences here. Okay, so all preferences and habits are important to the scheduler and the scheduling system, because you need to make sure that you accommodate everything. And providers also have to have time to make phone calls, examine and dictate reports, attend meetings, answer the mail, and they have other responsibilities. So seeing patients just isn't their sole responsibility. You need to consider the following factors: the provider's preference for a packed waiting room or an unpacked waiting room. The provider, do they worry over patient wait time? If the patient is backed up a long time, are they starting to get uneasy and be like, well, they're really upset? Are they prompt? Is the provider prompt? Are they on time? And do they keep to the schedule? Are they able to transition from a patient to a patient, or do they need a little time in between to gather themselves, do a little bit more research on the patient they're seeing, and then go in to see that patient? Do they need breaks? And then what is the quantity or time they like to spend with patients? Those are all things to think about when you're deciding on which scheduling method to use and when creating your matrix. And we're getting into creating a matrix right now. So if you look on page 148 in your textbook, page 148, you will see a matrix that has been put in through SimCharts. And we do have this program here if you're interested in playing around with it and doing some assignments and learning how to use that computerized machine more appropriately. and more in depth, please feel free to ask me. We'll get you hooked up, and we'll get you on your way on this. So, creating an appointment matrix. The first thing you need to do is block out times when the provider will not be able to see patients. Now, this could be for they have hospital rounds they got to do, or they have to attend conferences or meetings or lunch breaks, things like that. So, in a paper-based system, the matrix is usually established for 6 months at a time. So you go ahead and you draw up the matrix for 6 months at a time. In a computerized system, however, the matrix can be set up indefinitely. You can extend it forever, or you can change it daily. It's really up to you guys. So if you look at procedure 10.1 on page 149, that really goes over the steps for establishing an appointment matrix. And if you go over those and you create your own little matrix, it'll be beneficial for you. You'll have a better understanding of that. So establishing guidelines for appointment scheduling. So the scheduler must know how long various office visits take and different procedures as well. So it's important to have an understanding about what the patient is coming in for and how long that procedure really takes them. So when scheduling, make sure to allow enough time to complete a procedure. For example, never schedule a pap smear or a minor surgery for a 10 or 15 minute time slot. Those times are going to take up longer times, and you need to adjust accordingly. So the shortest office visit type should be a follow-up or a recheck appointment. All right, those should be your 5, 10, 15-minute appointments. Some providers need prompting at the end of the visit to move on to medical assistance, and medical assistants can help with that. You never want to get a provider that likes to talk to a patient. They get them stuck in an office, and that stops the patient flow through the office. So it's important to use the office policies and procedure manuals to figure out the exact appointment times, how long each appointment is estimated to take. The provider's reimbursement from insurance companies is partly based on time requirements for procedures or visits. For example, when I was working as an athletic training student, I was going through college and I had to do some clinical rotations in a physical therapy clinic. Physical therapists get reimbursed and paid from patients' insurance companies based on the amount of time that they do specific things or exercises. So, for example, like an ultrasound treatment where you put in, you're using ultrasound technique to rehab and alleviate some pain for that patient, you have to do that for 8 minutes. And if you do it for 9 minutes, you can only bill for 8 minutes. That's the 6-minute block. So all ultrasound appointments were 8-minute long little sessions. Available facilities. This is also important. Okay, knowing what equipment and rooms the practice has available will keep you from scheduling 2 patients at once who need the same services. So the medical assistant must know how to pair the patient's needs with the available facilities when scheduling. So it's really important that you can really learn and grasp in your medical clinic, okay, what's really going on there. So there are 2 common methods to scheduling appointments. There's the computerized appointment and there's the appointment book or paper-based. Okay, each has their advantages and disadvantages, and the provider's office should weigh the benefits and choose the method that best suits the provider and staff. If you have a small office, you have one provider and one office manager and one medical assistant, maybe a simple paper-based medical appointment scheduling book is fine. However, for most generally nowadays, everything is being done computerized. You will have a computerized medical record system as well as appointment scheduling and prescriptions, and everything like that is going to be done on the computer. So let's talk about computerized scheduling. Okay, software programs can vary from simple to more sophisticated ones that select the best appointment time based on the information that you entered into the system. It can also keep track of future appointments, and you can have printouts of the schedules to help staff and providers stay on schedule. So you can print a hard copy of the next day's appointments before leaving each evening, so that when you go into the next morning, it's all laid out and everything's going to run smoothly from there. So more than one person can access this schedule at the same time, so that everyone is informed. You don't have just that one book that you're passing from person to person. Any staff member at any computer can pull up the schedule and see it from there. So some offices keep an appointment book as a backup to the computer system. If everything crashes, goes down, you still have a backup there as well. So this is appointment book scheduling. Now this is on page 150 in your textbook. It's a small one down in the lower left-hand corner. So there are many styles of appointment books, and some are color-coded. This one is color-coded. And this one has the days done in different colors, so it's easy to flip through the days. If it's color-coded by day of the week, it is much easier for the medical assistant to quickly flip to certain days. So multiple columns can correspond to doctors in a group practice so that time can be divided according to their preferences. Okay, as you see here. Now, hold on one second, guys. apologize for that. Somebody had left a cell phone alarm on for some reason. So as you can see here, the multiple columns, you have 3 columns here. That is good for 3 doctors. So you can actually have you can schedule appointments for 3 different doctors in this one book. So this is a really nice, well put together appointment book. And then there's self-scheduling. So this allows the patient to use the internet to view the facility schedule, and then they can select their own appointment time based on the availability that they saw. So the system will protect confidentiality by showing only available times, not patients' names and when they are scheduled. Okay, so this will help reduce the call volume to the office because it's available to the patient 24/7, and they can get on and schedule their appointment instead of having to call in and get you to schedule it for them. It can also send email reminders for the day before the appointment to request an appointment. And then phone-in appointments have to still be offered though, because not everybody is in tune and up to date with the most recent technology out there. So it's important that you can appease to everybody. So these systems will help reduce the wait time for patients who do not care to wait on hold. They can just simply call in, or they can just simply get on and take care of things themselves. So the legality of the appointment book. Now this is important, guys, so you need to really pay attention to these next slides throughout here. So the appointment system must be accurate because it can be used as a legal record, all right? Everything that is done in the medical office can be used as a legal record. So some appointment books include the reason for visit, but that isn't necessary if you reference the time needed for the appointment and then block off that appropriate amount of time. However, most computerized scheduling systems will allow the user to indicate whether the patient has checked in, canceled, or missed his or her scheduled appointment. So you can keep track of all that right on the computerized software system. So missed appointments should be noted in the medical record. So if they fail to show up, it needs to make sure that it's in there. When a patient misses or cancels an appointment, it should be documented in the electronic patient record for legal purposes. In an appointment book, pencil is used so that changes can be made easily. This is really the only time you're really going to use pencil in the medical office, is in the appointment book. A patient's name, it should include the patient's name and their phone number so you can see who has that time blocked off, and then you can call, have their phone number right there so it's easy to call them to confirm their appointment. And then the appointment book should be kept for the state statute of limitations, and that varies from state to state as we talked about previously. And then once that statute of limitations has passed, you can shred it and discard it for privacy reasons. Now, we're going to get into the more specifics about appointment scheduling and different types of that. And this is super, super important, guys. You have to know each type of scheduling system and then when and how it is used. So really pay attention to these slides coming up. So different types of appointment scheduling to meet different needs of the facility, the providers, and the patients. So some offices will combine methods to make the right mix of activity during the day and to ensure that the day runs smoothly. So you have to be proficient at managing appointments to be a successful scheduler. So the following information presents several different methods of appointment scheduling, and it is super important that you pay attention and really grasp these. If you have any questions about any types of scheduling system I'm going to talk about here, ask me, please. So the first one we're going to get into is time specific, which is also known as stream scheduling. Now, if you think of stream scheduling and you think of a stream, it's a constant flow throughout the day. Like a stream is constantly flowing, it never stops. And it's the same way with the patients that are coming into the office. So this is when scheduled appointments allow practitioners to see more patients with less pressure. It requires a person who is good at multitasking and at being efficient. And it is critical to understand how long each procedure requires and time for pre-visit paperwork. So the scheduler must develop the skills to accurately assess how long each visit will take in order to efficiently set appointments. So this one is set up so that you schedule the patient for their appointment time. All right, so say they have a 15-minute checkup, okay? You know to schedule them for 15 minutes. You don't have to schedule them for 30 minutes. Followed by, you have a minor surgery that's going to take 45 minutes. And then, so you really just go throughout the day, keeping the patients, you want to have every block filled, but you want to have a constant flow throughout the day. The time of the appointments will vary based upon what they need to be there for. Then you have wave scheduling. Okay, so stream, you think of streams, it's constantly flowing throughout the day. Wave, it comes in just like you're at the ocean. The water comes in waves, the patients come in waves. So this attempts to create short-term flexibility within each hour. So this assumes that time needed for all patients will average out over the day, and then rather than scheduling at interviews, several patients will be at the office at once and then seen in the order of arrival. So a benefit is that one person's late arrival won't disrupt the whole day's schedule. So with wave booking, you have patients, say your office opens at 8. So you have 3 patients scheduled to arrive at 8 o'clock. They will be seen in the order of arrival. Whoever shows up first is seen first. Okay, and then you have nobody else scheduled for the rest of that hour. So at 9 o'clock, 3 more patients would be scheduled, and they would come in order of being seen, and they would go out by 9 o'clock. So it really is just based upon, this just helps create short-term flexibility within each hour. You know, if something arises and you have an emergency you need to handle, you know, it is there for you. So wave booking is when you have 3 people show up, 3 more people show up at the same time, and then they are seen in the order of arrival, okay? Don't get that mixed up with modified wave booking. It's very, very similar, but it is different. So we've talked about the examples of wave booking. 3 people show up at the same time, and then they're seen throughout the hour. Another example would be like modified wave booking, okay? And it would be to have like 2 patients come in at 10, and then 1 at 10:30, and then you repeat that cycle throughout the day. So it's still similar to wave booking. It's just instead of having all 3 show up at 10 o'clock, you now have 2 at 10, 1 at 10:30, just to help keep the flow going. Another example is patients could be scheduled to arrive at given intervals during the first half an hour, and then none scheduled during the second half of the hour. So for example, you could have 1 at 10, and then 1 at 10:15, and then 1 at 10:30, and then nobody else is scheduled for the rest of the hour. All right, that is kind of the same way. And basically, this allows times for urgent or walk-in patients that need to be seen. Okay, it just helps create that flexibility. So that is modified wave scheduling. Double booking. Okay, double booking is booking 2 patients at once to see the same provider, and that is poor practice, guys. Now there is a couple exceptions for that, and that could be 1 patient will only take 5 minutes, and it is not considered double booking if a patient comes to the office to receive treatment by someone other than the provider, such as a patient receiving physical therapy or like an anti-allergy injection or something like that, okay? Double booking should be avoided and should be reflected in the schedule as well. Then you have open office hours, or this is also known as tidal wave booking, okay? And this is important as well, okay? So this is basically the facility is open at given hours when patients are told to return in a couple weeks or to follow up. Okay, the patients can come in at intermittent times and seen in order of arrival. Some will allow online or telephone check-in so that the patients can be notified when it is their turn. They can show up then, and that will help them from waiting all day long. So this eliminates broken appointments and prevents from running behind schedule because there isn't a schedule. It's just first come, first serve, and then you go through the day as needed. It's most commonly used in labs, imaging facilities, urgent care clinics, emergency departments. Guys, that is a tidal wave booking. You go into an emergency department, you check in, you sit and wait for your turn. Okay, that is tidal wave booking. Now the disadvantages of this can include crowding, long waits, waves of busy times, and then waves of slow times, and it could be potentially overburdening to staff. So if this is what you do, you will see yourself most generally in like an emergency department type of setting, okay? Then you have grouping procedures. This is also known as categorization or categorizing procedures. Okay, and that is putting the procedures or grouping them is another way to approach scheduling. So medical offices may try several ways of grouping before finding the best way in the practice, and the medical assistant may find it helpful to color code sections for grouped appointments. So an example of this, okay, an internist might reserve all morning appointments to complete physical examinations, or a pediatrician might keep that time for well baby visits. Okay, so another example would be like a gynecologist obstetrician or an OBGYN. Okay, in Tuesdays and Thursday mornings, maybe they do STD checks, things like that, and then in the afternoons they do all the pregnancy visits for the mothers to be. Okay, that's another example of a grouping procedure. Advanced booking is another type here, and advanced booking is when appointments are often made months in advance. Okay, an appointment card should be given to the patient and should require 24 hours notice of any cancellation. So most offices have a confirmation procedure on which patients are called the day before to verify that they intend to make that appointment. So time patterns within the medical office. Now what I mean by this is what you can expect throughout your day. Now the busiest days in a medical office are going to be your Mondays and Fridays. All right, either they're trying to get in and be seen before the long weekend, or they got sick or ill or injured over the weekend and they want to get seen on Monday. Okay, so special oral problems arise daily and sometimes should be open for daily for the provider to deal with minor emergencies and different things like that. So these schedule slots reduce this disruption throughout the day. So if it's possible, block out 15 minutes each morning and afternoon for a break for the provider to return calls, verify prescription calls, or answer any questions, things like that. So keeping one time slot available in the morning, in the afternoon, specifically for emergencies, is also good practice. And then telephone scheduling. So most of your communication is going to be done over the phone with patients. However, you still will interact with them when they come into the clinic as well. However, your first appointment you ever schedule with a patient, they're a new patient, they're coming into the office, it's most generally going to be over the telephone. So often the manner in which the booking is made often makes more of an impact than the convenience of the appointment time. So if you were handling your job and doing it professionally, regardless of the appointment times you give them, it will work out most generally for you. So it's important to be pleasant and helpful when scheduling over the phone. You want to try to accommodate the patient's requested appointment time if possible. If not, be considerate and I'll offer alternative dates. Okay? This next one is key. It'll be on your CMA exam. Offer 2 choices for a time slot is encouraged so that the patients feel that they are in control of their time. For example, you could say, Dr. Jones isn't available this afternoon at 1 o'clock, but you could see him tomorrow anytime. We could give you like a 9 o'clock appointment, or we could do a 1 o'clock appointment. And give them that opportunity to make the decision so that they feel they are in control. Okay. Always repeat the date and time of the appointment at the end of the call, and ask if the patient has a pen and paper to write it down so that they remember it as well. Once you've done that, check the appointment book or the computer screen to be sure that it is entered correctly on the right day, at the right time slot, those types of things. And then write legibly in the appointment book and obtain a daytime phone number for each patient. So having the patient's cell phone numbers makes it easier to contact them quickly, especially nowadays when everybody has a cell phone just about. That's really helpful as well. So scheduling for new patients. It is different than scheduling for established patients. So a new patient is somebody who's never been in your office. It's the first time seeing a doctor with you. So it's important to give them a lot of information up front. So new patient scheduling requires time and attention to detail. Tact, courtesy, and professionalism are also very important, as always. It's important that you request preliminary information so you know how much time to allot. What are they needing to be seen for, and other questions along those lines. So the provider may want you to give general instructions with the patients with specific complaints. Some offices get enough information to start a new medical record for the patient before the office visit even occurs, but others wait until the patients arrive. So it's really just based upon your clinic. If you look on page 153 in your textbook, you'll see procedure 10-2, and that describes how to schedule appointments for new patients. So read over that, educate yourself, and be aware of that. So let's continue on with this. So when you're scheduling that new patient for a visit, offer the patient the first available appointment, but also give them the choice between 2 dates and times. Offer directions or physical address to the office. They've never been there before. They don't know what to expect. Just like you need to provide parking information. Is there a parking garage for your clinic? Is there a fee? Things like that. Options for first payment should be discussed. So you should expect the patient to have concerns about the amount of the first bill, and should be sure to address the issue before the appointment to avoid misunderstandings. They need to know that when they come to the office, they're expected to pay their copay. Things along those lines. And then repeat the date and time and thank the patient for calling at the end of the call, just to make sure everybody is on the same page. Some medical offices mail or email information packets to new patients. Okay, those information packets can include information that should inform the patient about the nature of the practice. They could introduce the medical staff and explain appointment policies and financial arrangements. So those are some different things that could be included like that. On page 154, at the bottom of the page, you'll see procedure 10-3, and this is actually your assignment for this section, guys. You need to describe how to create a new patient brochure, and you are actually going to create that new patient brochure. So it's important to know and make sure you hit on everything that we've talked about in these slides. If a patient is a referral, you may need to call the referring provider's office for additional information before the appointment. Print and give information or referral information to attending provider before the patient arrives, and then make sure you send a thank you note to anyone who refers a patient to the medical office. They're sending you patients, they're sending you money, so it's important to acknowledge and appreciate other people helping your practice out, as well as the patients that you are going to be dealing with. It'll be your job to confirm appointments. So many offices call patients the day before their appointment. And this can help eliminate last-minute cancellations. You can also send email, or an automatic dialer can be used to send these reminders. If you have a computerized messaging system, it might be all done on like an automatic dialer now. And then you may need to conduct pre-authorization or pre-certification to determine the patient eligibility for certain procedures. So that's basically calling the insurance company and verifying that they are going to be covered if that procedure is done. All right, the office manager must make certain that these procedures are being done and assign these duties to a specific person. Now, it could be some people handle some things, some people handle the other. It just depends on your office. So we talked about scheduling appointments for new patients. Now we're going to talk about scheduling patients for established patients. And the first one we're going to talk about is in person. So most generally, most return appointments are arranged when the patient is leaving the office on their way out the door. They stop by the front desk and check out with you and schedule their follow-up appointment. So that's important to have them all stop by the front desk before leaving in case information is needed or outside scheduling needs to be done as well. Ordered tests and procedures can be discussed and scheduled at that time up front. And then, as always, offer the patient a choice of 2 dates and times. Always give the patient an appointment card as they leave, and remember to smile, of course. And then if you look on page 155, you'll see 10-4, which describes how to schedule appointments for established patients. It is different than new patients. There's a lot less you have to discuss. So that was in person. Established patient in person. Now we're going to talk about established patient over the telephone. So it's important to find a suitable time in the schedule and only need to know when the patient must return. All right, so if it's 2 weeks from now, you just look 2 weeks ahead. You don't have to look at every day. If the office has recently, there's no need for directions or parking. They know where they are. They know how to get there. If the office has recently moved, however, it's important that you give them directions and parking information to those established patients as well. And then recheck information with the patient if it's been a while since the last visit. And those things could be like address, their phone number, insurance companies or benefits, their email address. Just make sure you have the most up-to-date information on that patient. You'll have to be able to schedule other types of appointments, and this could be done for the physician. All right, so other types of appointments to schedule could be like inpatient surgeries. You have to schedule the physician for outpatient and inpatient procedure appointments. Schedule the physician for outside visits or for other providers. You might have to schedule pharmaceutical reps and salespeople to visit with a provider. So it's important to know all the differences, guys. So remember, if you are scheduling a physician at an outside appointment with another provider or at an outside visit or a house visit, it's important to consider driving time. Okay, make sure you block off enough time for them to get there and to return without putting anybody behind schedule. So if you're scheduling for inpatient surgeries, when scheduling surgery, call the facility where the procedure will take place as soon as it is planned. Okay, most surgical departments and centers have a surgical secretary who can make those arrangements. It's important that you provide all necessary information and state any special requests the provider may have, and then you may need to provide insurance information and certainly their phone numbers. You'll have to arrange for outpatient and inpatient procedure appointments. So arrange laboratory and radiography appointments for patients. All right, if they come in to see you and your provider thinks they need to get an x-ray or something like that, you can, and you are supposed to, arrange those appointments for the patients. It's important that you have all information handy before calling the facility to schedule. That way you're not having to flip through papers and find the information that you need. And then make sure you relay the time and place of the appointment and any special instructions. Also note those special instructions in the medical record, but make sure that you let the patient know of those special instructions as well. Some offices make a reminder call to the patient or send them an email message, as we've talked about earlier. And if you look at page 157, you will see 10-5, and that's how you describe how you schedule a patient for a procedure. And we are almost done here, guys. Just a few more slides. Outpatient and inpatient procedure appointments. Now, outpatient testing is so much more common nowadays, and that's because most medical offices do not have extensive x-ray or laboratory equipment on site, so you schedule them at an outside facility where that can get done. So MRIs, CT scans, x-rays, ultrasounds, and other simple blood tests could all fall into this category and would all be things that you would have to be able to schedule. So it's important to provide the patient with the name, the address, and the phone number of the facility where they're going to be getting their testing or lab work done. That way they can follow up with any questions and find where they are going as well. Scheduling inpatient admissions or surgical procedures is similar to outpatient scheduling, but the medical assistant coordinates with a hospital instead of an outside testing facility. So some patients require a series of appointments. All right. Now, if that's the case and they need to be seen 3 times a week, easiest way to do that is to do like a Monday, Wednesday, Friday at 8 a.m. or pick a time that is the same and common throughout all of them. Like I said, try to set these up at the same day and time of the week to reduce the risk of the patient forgetting. And it may be responsible for scheduling inpatient admissions and inpatient surgical procedures as well. You have to schedule outside visits. So this could be if the provider makes house calls or visits patients in skilled nursing facilities. It's important to block out time in the regular appointment schedule book for that because the provider or physician is unavailable. It's also important that you allow travel time for that. Okay. However, most providers don't make house calls because it's inconvenient, but sometimes it could be necessary. So it's important that the provider's medical bag should always be ready and prepared to go and well stocked for outside visits. That way they can just pick it up and go. And this is where we're going to end today, guys. This is on this slide here. And that's providers, pharmaceutical reps, and salespeople. So another provider dropping into the facility should be ushered in to see the provider as soon as possible. That's just professional courtesy. Get them out away from the patients, get them in a private room, and then have them meet with the provider as soon as possible. Medical assistants need to screen pharmaceutical reps. Okay, pharmaceutical representatives will oftentimes bring in samples of medications and things like that. The pharmaceutical representative is usually quite understanding and cooperative and willing to wait patiently for a long time for a short meeting with that provider. Okay. Unsolicited salespeople can sometimes present a problem though, so it's important that you have a list and you know the pharmaceutical companies that you work with. And if they're unsolicited salespeople and they want an appointment with the provider, have them leave the materials and let them know that the doctor will call them back if he requires or requests any other information from them. And that's it, guys. So it's a really important chapter today. Really focus on the different types and methods of scheduling, whether it be stream, wave, modified wave, tidal wave, or open office, grouping or categorization booking. So it's really important to have a good grasp understanding of that because you will be tested on that on your CMAA exam. Have fun, keep working hard, let me know if you have any questions.